Joins the world in marking World TB Day. There exists a challenge on the drug-resistant TB, which has left medics and researchers scratching their heads as they seek to find a cure and medical solution to the disease. And our health and science reporter Elizabeth Atieno spoke to pathologists on some of the interventions in TB testing and treatment and compiled this report.
This lab is a beehive of activities. The health practitioners are glued on their seats, busy collecting and analyzing samples to test for TB, a disease that affects over 133,000 Kenyans annually and claimed the lives of 1.25 million people in the world in the year 2023 alone.
So we take specimens like sputum, we take specimens like acidic fluid, pleural fluids, cerebrospinal fluids, CSF we call it, and we prepare them, stain them, and we actually demonstrate mycobacteria.
This machine offers a solution to undetection of TB. The test being conducted here is called the quantiferon test, which enables doctors to detect latent TB and establish if it will progress to active TB through the collection of a blood sample. This test is mostly performed on people with compromised immunities like people living with HIV, people with cancer, kidney disease, and diabetes.
By the way, Elizabeth, this has been now also proved for all the immigrants when they come in, all the students who go into hostels, for just to make sure that they do not come and spread the tuberculosis.
Multi-drug resistant TB, which is caused by TB bacteria that are resistant to at least one of the most effective TB medicines, remain a public health crisis, with only 2 out of 5 people with drug-resistant TB being able to access treatment.
So non-compliance is one of the reasons. They don't take the drugs, they stop and then start. That causes a drug resistance. And the second one that has been pointed out here, several papers, is that we get substandard drugs.
Kenya is currently grappling with this challenge, but the TB PCR or molecular-based test is offering a possible solution to this challenge. This test has the ability to pick up drug-resistant and low-antigen TB. TB culture is another test, but is not commonly used in medical practice.
Before we can rule out tuberculosis, the test can take up to 8 weeks. The clinicians do not have that luxury. They have to make the diagnosis earlier.
But this test can equally help detect drug-resistant TB bacteria and prompt the doctors to work on a possible treatment.
But if we do the culture studies now, and you pick up a mycobacterium that is actually a tuberculous bacillus, that is identified but is resistant, they take that and they do the entire NGS, the molecular use of that mycobacterium.
Drug susceptibility test is repeated if a patient has a positive culture for TB after 3 months of treatment and if the patient does not seem to be getting better. Additionally, healthcare providers use the results of drug susceptibility test to choose the appropriate drugs for treating each patient. It is, however, unfortunate that some patients develop a strain of TB that may become resistant to additional or multiple TB drugs.
Complication like tuberculosis meningitis, that itself has a long-term complications on the patient's outcome.
Children account for almost 10% of TB cases, and it has proven to be challenging for medics to collect samples and test children for TB. However, a new technique is being embraced to save the lives of children.
So now what the attempt is to find in the feces, in the stool specimen of the child, if we can demonstrate mycobacteria.
$22 billion is needed annually for TB prevention, diagnosis, treatment and care. However, with the dwindling donor support, the world might witness a surge in cases of multi-drug resistant TB, considering that the molecular-based test, which is equally the most expensive means of TB testing, might face a huge setback.
It is a big concern, because most of the centers use gene expert, which is had been funded by donor agencies.
Global efforts to combat TB have saved an estimated 79 million lives since the year 2000. It is equally important to highlight that the African region has made remarkable progress in the fight against TB. For instance, deaths from TB has declined by 42%, while the cases have dropped by 24% since 2015. Treatment coverage has risen from 55 to 74%. Elizabeth Atieno, TV 47, Nairobi.